Welcome. I'm James Earl Jones. The quest to combat disease and improve the quality of human life has led to great advances in health care. Many of the most important strides were made in our lifetime. We are a privileged generation. Here's one important breakthrough.
In late 2011, I felt a lump in my breast and I saw a doctor, and about 3 months later we found out that I had breast cancer, stage 3C breast cancer. And bilateral mastectomy was inevitable. And you don't know what's going to happen until you actually have it done. And once you have it done, then you start dealing with, wow, this is my new life. This is my new body. Having your breast removed is a constant reminder that you're sick. It's not just flat, it's flat. The worst part about being diagnosed with the BRCA2 mutation is knowing that it's possible it could go to my daughter. She had to have me tested, and sure enough, she tested positive for the BRCA2 mutation.
When I found out I had the BRCA2 mutation, I was newly engaged, college student, trying to help my mom beat cancer, and I knew a double mastectomy and reconstruction was my best option, and it was really scary. It's like having your whole future pulled out from underneath you all at once.
Plastic surgery in the eyes of the lay public is often thought of as cosmetic surgery or vanity surgery. The reality is, oftentimes the reconstructive surgery deals as much with function as it does appearance. Breast reconstruction for women facing loss of the breast through mastectomy is one of the more emotional situations that plastic surgeons deal with. It allows a patient who undergoes breast reconstruction to be able to appear more normal in public, to feel more confident. It allows them to resume a more normal life.
Microsurgery is a technique, and it also is a specialty, but essentially what that entails is using strong microscopes and very, very fine tools to bring back together very tiny structures, oftentimes blood vessels. And it really has revolutionized breast surgery and breast reconstruction.
Women who are faced with a diagnosis of breast cancer and they need a mastectomy, they need not fear that they will be disfigured. By utilizing the tissue in the lower abdomen, we can actually transplant that and provide soft, natural, warm-feeling breast. And the second advantage of this technique is that it allows women to lose some of the lower abdominal tissue that they've gained over the years, and it's an extra bonus. They get a tummy tuck in the process.
I knew I had an 87% chance of getting breast cancer in my lifetime if I didn't have a mastectomy and reconstruction. And seeing my mom do so well with her surgery and reconstruction, I knew that that was just the decision I needed to make.
Insurance covers breast reconstruction, including any symmetry procedures for the opposite unaffected breast. There was a law that was passed in Congress in 1998 saying that insurance companies can't refuse to cover that.
The way we stay informed about emerging trends in breast cancer reconstruction is by attending local and national meetings to stay informed on the topic. We also participate in weekly meetings to discuss specific patients and their total cancer care, and reconstruction is obviously a key component of this. We stay apprised of the literature and surgical techniques that are involved in providing the best options for patients.
Breast reconstruction surgery has really developed into my passion because it allows me to give women back something that I think is so important for their lives. And being able to provide patients with something that makes them feel like themselves again is one of the most rewarding things that I can possibly do.
Pre-surgery, I was really apprehensive and nervous about what I was doing. But once I woke up from surgery, I instantly knew I had made the right decision, and it was the best decision I could have ever made.
As modern medicine and healthcare continues to improve, those improvements will be highlighted here. See you next time. I'm James Earl Jones.